In the 1840s, if you were sick or injured in Europe, the most dangerous place you could possibly go was a hospital. If you broke a leg on the streets of London or Vienna, rich citizens would hire a doctor to treat them at home. But if you were poor, you had no other choice than to be carried into the grand, imposing doors of the charity wards. Once those heavy doors close behind you, your chances of walking back limited. In some maternity and surgical wards across Europe, up to 80% of patients never left alive. They didn't die from their original illness or injury. They were killed by an invisible, suffocating horror lurking right inside the room. A mysterious rot that doctors were unknowingly spreading with their own hands. Welcome to the era of hospital gangrene. This is the story of the lethal birth of modern surgery and the man who realized the deadly truth before anyone else was willing to listen. To step inside a 19th century hospital was to step into a sensory nightmare. There was no air conditioning. Windows were kept tightly shut because doctors then believed cold air carried miasma, a mythical poisonous bad air that caused disease. As a result, the air inside the wards was thick, stagnant, and sickeningly sweet with the smell of us, rotting flesh, and unwashed bodies. Surgeons of the era didn't wear sterile scrubs or rubber gloves. They wore their everyday black frock coats. The stiffer and more blood-covered the coat was, the more experienced the surgeon appeared. A coat stiffened with dried blood and fluids was a badge of honor. Surgeons would walk straight from performing an autopsy on a decaying corpse in the basement, wipe their scalpels on their trousers or a shared sponge, and walk directly upstairs into the maternity ward to deliver a baby. To them, germs didn't exist. They couldn't see them, so they didn't believe in them. And that ignorance was about to trigger an unprecedented wave of slaughter. It usually began 48 hours after a patient was admitted. A mother who had just given birth or a man with a minor leg wound would suddenly develop a soaring fever. Their skin would flush hot. Then came the local infection. A small, painful red ring would form around the wound, or surgical cut. Within hours, that red ring turned ash-gray, then jet black. The flesh was literally dying while the patient was still conscious. This was hospital gangrene, or in maternity wards, childbed fever. It moved with terrifying speed. Flesh melted away, releasing a stench so foul that nurses would faint trying to dress the wounds. The infection seeped into the bloodstream, triggering septic shock. Within days, robust, healthy young mothers and strong young men were dying in agony. In the famous Vienna General Hospital, the crisis reached a point of pure absurdity. The hospital had two separate maternity clinics. First clinic was staffed by medical students and doctors. Second clinic was staffed entirely by midwives. Women arriving at the hospital noticed something horrifying. Women admitted to the first clinic, the doctor's clinic, were dying at rates 5 to 10 times higher than women in second clinic, the midwives' clinic. The terror was so widespread that pregnant women literally dropped to their knees on the street, weeping and begging not to be sent to the first clinic. They preferred to give birth in the cold gutter of Vienna. rather than cross the threshold of the doctor's ward. In 1946, a young Hungarian physician named Dr. Ignaz Semmelweis was appointed head of the first clinic at Vienna General. Haunted by the agonizing screams of dying mothers, Semmelweis became obsessed. Why were women dying in the doctor's clinic but surviving in the midwife's clinic? He analyzed everything. Was it the climate? No. Both clinics were in the same building. Was it overcrowding? No. The midwife's clinic was actually more crowded. Was it modesty or religious fear? He ruled it out. Then, in 1847, tragedy provided the terrifying answer. Semmelweis' close friend, a professor of forensic medicine named Jacob Poleshka, was accidentally poked in the finger by a student's scalpel while performing an autopsy on a woman who had died of childbed fever. Days later, Poleshka died. His symptoms, the raging fever, the blackening tissue, the organ failure were 100% identical to the mother's dying in the first clinic. The lightning bolt struck Semmelweis' mind. The doctors and medical students were starting their mornings in the autopsy room, dissecting rotting corpses. Then, without washing their hands, they walked directly into the delivery rooms to examine pregnant women. They were carrying microscopic, invisible particles of the cadaver tissue, deadly toxins, directly into the open wounds of the living patients. The midwives didn't perform autopsies. That was why their patients survived. Semmelweis instituted a strict new policy in May 1847. Every doctor and student leaving the autopsy room had to wash their hands in a harsh solution of chlorinated lime before touching a patient. The results were instant and miraculous. Within months, the death rate in the first clinic plummeted from nearly 20% down to under 1.2%. For the first time in decades, the first clinic was safer than giving birth on the street. Semmelweis had conquered the hospital gangrene. He had saved thousands of lives with a simple basin of chlorine water. You would think Semmelweis was celebrated as a hero. Instead, the medical establishment turned on him with vicious anger. To accept Semmelweis' theory meant accepting a horrifying truth that doctors, gentlemen of high science and status, had been personally killing their own patients for decades. They had tried, couldn't handle it. Prominent surgeons mocked him. They argued that hands couldn't possibly spread disease because hands were clean. They refused to wash. Semmelweis was fired from his position, hounded out of Vienna, and driven into deep isolation and severe depression. He began writing furious, desperate letters to medical journals, calling doctors unintentional murderers. In 1865, broken by despair and deteriorating mental health, Semmelweis was tricked by his colleagues into visiting an asylum in Buda, Hungary. Once inside, he realized it was a trap. He tried to leave, but guards severely beat him, put him in a straitjacket, and locked him in a dark cell. 2 weeks later, Ignaz Semmelweis died at the age of 47. The cause of his death, an infected wound on his right hand, likely sustained during the beating or an operation, that developed into sepsis, the very illness he had spent his life trying to eradicate, killed him in an asylum cell. It wasn't until decades later, when Louis Pasteur developed the germ theory of disease, and Joseph Lister introduced antiseptic surgery. That the world finally recognized Semmelweis was right all along. Today, Ignaz Semmelweis is remembered as the father of infection control. The next time you walk into a hospital and see a dispenser of hand sanitizer on the wall, remember the tragic history behind it and the thousands of souls lost in the hospitals of death before the world learned the lethal power of microscopic horror.